Hello, good evening, everybody. I wanted to speak about bipolar disorder today. It's a condition that uh, everybody's heard about it, and it's even crept into the lay language that everybody thinks that they know what bipolar disorder is. The fact is that it's a very serious illness and has a defined course, a definite set of symptoms, and definite treatments that are effective. So let's see what this is about. So bipolar, means two poles of a mood state. So you can be, the person can be, you have the normal ups and downs, the normal life. A normal life doesn't mean that you're never depressed. It means you're depressed, but you bounce back. A depression, like a depressive mood state, is when you're persistently depressed for a week, 2 weeks or more, and nothing can kind of make you cheer you up. You lose interest in activities and kind of feel down on yourself, low energy, all of that. So that's one side of bipolar disorder, the depression side. And then there's the other side of it, which is mania. And mania is basically an excess of energy, excess of enthusiasm, an elevated mood state where you feel you're invincible. You're Superman or Superwoman, whatever your hero is, that you feel like you can do anything. And that state is mania. There's a state called hypomania, which is a little bit less than mania. Mania, and when a person is manic, they're dysfunctional. They can't really discharge their roles and their functions in society. But in a hypomanic state, which is a little bit under the mania, they can function. So anyway, that is kind of an overview of what we are talking about, bipolar disorder. So it is a person that is afflicted with episodes of altering low mood states and interspersed with periods of normality, and then elevated mood states, back to normality, back to depression, or it can be, back-to-back depressions or back-to-back manias. So there are many variations in how bipolar disorder can manifest itself. Stress definitely precipitates and brings it out. There are even some theories about early childhood trauma and stress and its relationship to precipitation of bipolar disorder in those that have a tendency for it. So speaking of that tendency, like what causes this? Bipolar disorder is a very much a genetic illness. Like almost, let's say 80 to 90% of the cause for bipolar 1 disease state is genetics, okay? And which means that identical twins will have a concordance, like about 60% of them both of them may have the illness. It's pretty high concordance, so that tells you it's pretty strongly genetic, versus about 10% concordance with their fraternal twins, born of the same mother, same womb, but they're different genetics, slightly different genetics, and their risk is much less. So genetics plays a role. The incidence, it's about distributed equally amongst men and women, and the incidence is about 1%. Some would say pull it to 1 to 3%. That's still a significant amount of people. If you include bipolar 2, and then definitely the incidence is more around 2% perhaps. And most people are able to function, but the ones that are really sick are not able to function. And it is a real showstopper for them. There's some famous people that have had bipolar disorder. Ted Turner acknowledged it publicly that he had it. There's others as well. I'm not sure about Robin Williams, but I think he also was diagnosed with it. The from the accounts in history, some of the great emperors, rulers had a touch of mania to them. Alexander the Great was one of them. Tireless, fearless, indomitable, you know, without fatigue. He marched to the ends of the earth, and he combined it with his intelligence. And going back to the genetic side of it, his mother was also had symptoms that suggest that she had bipolar disorder. These gnats and mosquitoes. But so it's a lot of big personalities have had this illness. In fact, some people have called it the disease of the kings, and for good reason. I mean, look at these people can be very, very successful, because they have the energy, and if they're smart, they can organize that sheer energy and willpower and channel it in some direction. They would be able to achieve much. And usually it's hard to do when they're manic, and when they're manic, everything's kind of falling off the wheels. But when they're a little bit treated or in their hypomanic state, they can do wondrous things, wonderful things. Treatment-wise, there are several treatments that are available. You have to treat it because you can't let it go untreated. Untreated, it can last several months. To diagnose bipolar disorder 1, basically there are two different types of bipolar disorder. There's bipolar disorder 1, in which there's an episode of mania, like frank mania. These guys are like not sleeping, they're full of energy, they're talkative, their pressure of speech is hard to get a word in edgewise, they're impulsive, they're irritable, they get angry quickly. That's the lability of affect. They can also be very affectionate in no time, So that's, those manic patients with manic features, that's bipolar 1. And invariably, the depressive episodes also follow the manic episodes. When they don't reach quite the stage of mania, but a little hypomanic, like extra bouncy, extra happy, that's hypomania. That's called bipolar 2. On the depressed side, when there's a little bit of a distinction in the depression caused in bipolar 1 and the regular unipolar major depression. In the regular unipolar major depression, the person has loss of appetite, loss of sleep, and of course, they are socially isolative in all of this. And depression related to the bipolar disorder, there may be a greater incidence of those patients having a desire to sleep more than normal instead of less sleep, and they may eat more than normal instead of less appetite. So that is one of the differences. Regarding where it is in the brain that it's causes focused, or regarding where the pathology lies in the brain, that's not totally clear. They think it's the prefrontal cingulate gyrus is involved, the amygdala is involved. They have studies on these things that show some variations from normal over there. Some structural changes have also been implicated in the brain structures, but it's basically a affect or a mood regulation issue. It's complex because the brain is complex. We don't really understand how things finally translate into consciousness. For example, if somebody has a stroke on their right side, and with the left-sided weakness, these individuals generally tend to have manic symptoms. So, they have manic symptoms, these individuals with left-sided weakness, right-sided stroke. On the other, conversely, left-sided strokes with the right-sided weakness have depression. So the brain it's amazing, it's not a, you can't predict things necessarily from like a structure being affected and the consequent downstream effects of that. So there are certain medications that can also make it appear like the person is manic. These would be stimulants, amphetamines. Corticosteroids tend to elevate the mood. Certain illnesses like multiple sclerosis, they have a disinhibiting effect, so the person may be a little peppy. It can look like bipolar. ADHD patients tend to also be impulsive and fidgety, but there's no associated mania as such. There's no associated depressive episodes. It's just the ADHD that they carried from their childhood in a residual form that exists now. But some of those are differentials. Treatment-wise, lithium is the gold standard. It was discovered by David Cade, C-A-D-E, an Australian psychiatrist, back in 1949. And there was a lot of hesitation about lithium. It's a really very effective medication. But it took till 1970 when there was a double-blind study about the effects of lithium, where it was conclusively shown that lithium helps. Lithium helps greatly. It was in fact the first major psychotropic that was discovered in 1949. Then the antipsychotics came in the 50s, antidepressants in the 60s, and so on. And so second generation antipsychotics came around in the 1980s. Treatment-wise, lithium is the mainstay. It's a gold standard. Depakote, which is an anticonvulsant, also does help. Tegretol is a little bit trickier to use, but it also helps as well. It takes about a week to stabilize a person that's manic. It may take longer also. And depression, of course, takes 3 to 4 weeks. 4 weeks is what you should probably count on. And then you have to play around with the dosage and get it right, so where the symptoms are benefiting, the medicines are benefiting the symptoms, but it's not causing side effects. So that's what you aim for, the golden mean right there. Benefits, risks, patient is doing better, is functional without side effects. And you educate the patient. And psychotherapy is also useful. You provide education about the illness. You try to help them repair relationship, because when people are manic, they may say things that they would probably not have said when they were in their normal state. So it's helpful for them to explain to the other person, that, hey, I'm sorry if I said something wrong, but it's not me as much as maybe the illness that's driving some of the impulsive outbursts or behaviors. That helps them go a long way, and their friends and their family can become their biggest allies. So therapy helps. With all these medications, they have to be given under the guidance of a trained psychiatrist, because the lithium can be toxic in overdose, and their interaction with other medications like diuretics that can elevate the levels significantly. Any impairment in kidney function would affect lithium. ACE inhibitors, which are used sometimes for hypertension, like lisinopril, they say they can elevate the levels, but usually it's very marginal. And NSAIDs like Motrin may also have mild effect on the cause a little elevation of the lithium levels. Side effect wise, if a person on lithium develops tremors or diarrhea or fasciculation, shaking, they need to hold it. If there's any diarrhea, they need to hold it, because that can also elevate the concentration of lithium in the bloodstream due to dehydration. If the person is monitored carefully, like I said, they can do very well. Anyway, that's a little bit about lithium. I hope you're doing well. I'll see you in the next video. Thank you. Bye.